Hello, I'm Dr. Joshua Kreithen. I'm a board-certified plastic and reconstructive surgeon. My office is located in Lakewood Ranch. We just recently moved into a brand new office at 6310 Health Parkway, Suite 110, which is on the other side of the hospital near admissions. I specialize in breast and body contouring. I did my training at the University of Florida. The key to the breast augmentation surgery is the implant itself. And right now there are two implants available, the saline implant and the recently FDA approved silicone implant. Both implants are excellent, they look fantastic, but the key pros and cons between the two, the saline implant, it is made from salt water, and if it were to leak, the salt water is absorbed by someone's body. And the silicone implant, if that were to leak, it can lead to some issues, but the leak rate is extremely low for both implants. The saline implant, because it comes empty, can be placed through a very small incision, about an inch long, whereas the silicone implant comes pre-filled. You have to squeeze it in through a little bit larger hole. The saline implant is a little bit less expensive, the silicone implant is a little bit more expensive. But I think really the key, what it comes down to, is that for someone who has very, very little breast tissue, that palpability is one of the major issues, in that a silicone implant might feel more natural on someone who's very flat, whereas if someone has a decent amount of breast tissue, the saline implant still may feel pretty natural. Regardless, both implant results look excellent. Two important questions are, how long does the operation take, and what's the recovery time? And the procedure itself takes, I'd say, an average from 1 to 2 hours. Recovery time is about a month, but most people are feeling pretty good after a week or so. Everyone's pain tolerance is different. Some people say it was no big deal, and other people say it kind of hurt, and that's what pain pills are for. My restrictions for recovery time in the first month is not to lift anything heavy or do aerobics, but after about 30 days, most people can get back to their normal. The next important thing is obviously the cost of the surgery. I love to do these procedures so much, I would do them for free if I could, but unfortunately someone has to pay the bills. And the cost can vary. I would say the average cost for the saline implant surgery is about $5,000, and for the silicone it's more, it's probably about $7,000. And obviously my purpose is to have the results perfect the first time. Occasionally something can happen down the road, but it's real rare to have a complication. Most of the times things turn out perfect. When a patient comes to see me in the office for a consultation, I usually spend about 45 minutes or an hour. I go over the procedure in depth, and I have an extensive before and after book. But for people that want to just look at my work in general, you can go to my website, which is www.lakewoodranchplasticsurgery.com. That's one long word.